According to a new American study, the incidence of lung cancer among non-smoking women exposed to wood smoke from fireplaces and stoves is 64% and 99% for frequent users, compared to women who never use fireplaces and stoves. Another earlier study found a 21% risk. I tried to understand the reason for the significant difference between the results of these two studies. Here I will tell you briefly. You can read the full article in my free email newsletter on Substack. There are many more interesting and important details. The link to it is in the description. Looking ahead, I would like to tell you that while researching this topic, I have found that it is very likely that one category of women, and specified in both of these studies, may have up to 10 times higher risk of getting lung cancer than both of them. However, more research is needed to confirm or deny it. The women who participated in the new study were involved in another study, called the sister study. It involves only women whose sister has been diagnosed with breast cancer. These women have a 6 times greater risk of breast cancer than women in the general population. Unfortunately, the new study on the link between wood smoke and lung cancer did not specify how many women had been diagnosed with breast cancer before getting lung cancer. That's where the answer may lie. Indeed, women with prior breast cancer have a higher risk of lung cancer in the future. This is especially true for women with triple-negative breast cancer. But even these data don't tell the whole story. The fact is that 70% of women with breast cancer are treated with radiotherapy. The lung tissue also receives a certain dose of radiation during radiotherapy for breast cancer, which quite often leads to lung damage. Women with lungs damaged by radiotherapy are especially at high risk of lung cancer in the future. In Taiwan, for example, women who have undergone radiotherapy for breast cancer have a 10 times higher risk of lung cancer in the future. As another American study has shown, radiation therapy alone slightly increases the risk of developing lung cancer. I left a link to this study in the full text of the article. Apparently, the lungs weakened by radiotherapy are much more vulnerable to inflammatory and carcinogenic triggers such as cigarette smoke and wood smoke, and harmful fumes from overheated vegetable oil. More research is needed to confirm these assumptions. Women with chronic respiratory disease, or who are undergoing radiotherapy, should probably avoid using stoves and fireplaces indoors. Even healthy women are harmed by breathing wood smoke. This information should not be taken as medical advice. Please consult with your doctor. The link to my full article with scientific references is in the description below the video.